Hi everyone, I'm Jin Su. Happy to see you again. In this session, I will explain the last phase of the nursing process, evaluating. By the end of this session, you will be able to explain how evaluating relates to other phases of the nursing process. Describe 5 components of the evaluation process. In nursing process, evaluating is a planned, ongoing, purposeful activity in which clients and healthcare professionals determine the patient's progress toward achievement of goals and the effectiveness of the nursing care plan. Evaluation is an important aspect of the nursing process because conclusions drawn from the evaluation determine whether the nursing interventions should be terminated, continued, or changed. Evaluation can be done well or immediately after implementing a nursing intervention. Evaluation also can be performed at specified intervals, such as once a week for the home care patient. Evaluation continues until the patient achieves the health goals. As I mentioned before, the evaluating and assessing phases overlap. Assessment is ongoing and continues at every patient contact. However, data are collected for different purposes at different points in the nursing process. During the assessment phase, the nurse collects data for the purpose of making diagnosis. During the evaluation step, the nurse collects data for the purpose of comparing it to pre-selected goals and judging the effectiveness of the nursing care. The evaluation phase has 5 components. Collecting data related to desired outcomes. Comparing the data with desired outcomes. Relating nursing activities to outcomes. Drawing conclusions about problem status. Continuing, modifying, or terminating the nursing care plan. Using the clearly stated, precise, and measurable desired outcomes, which sometimes are the objective criteria as a guide, the nurse collects data so that conclusions can be drawn about whether goals have been met. It is usually necessary to collect both objective and subjective data. After getting patients' data, nurses compare data with designed outcomes. Then the nurse can draw one of 3 possible conclusions. First, the goal was met. That is, the patient response is the same as the designed outcome. Second, the goal was partially met. That is, either a short-term outcome was achieved, but the long-term goal was not, or the designed goal was incompletely attained. Third, the goal was not met. After determining whether a goal has been met, the nurse writes an evaluation statement, either on the care plan or in the nurse's notes. An evaluation statement consists of 2 parts, a conclusion and supporting data. The conclusion is a statement that the goal was met, partially met, or not met. The supporting data are the list of patient responses that support the conclusion. The third phase of the evaluating process is determining whether the nursing activities had any relation to the outcome. For example, when the nurse and obesity patient draw up a care plan, one goal was lose 2 kilograms in 4 weeks. A nursing strategy in the care plan was patient explain his plan of exercise and conduct exercise 30 minutes 3 times or above per week. 4 weeks later, the patient weighed herself and had lost 2.2 kilograms. The goal had been met. It is easy to assume that the nursing strategy was effective. However, it is important to collect more data before drawing that conclusion to make sure whether the nursing strategy really related to that outcome. The nurse needs to ask that, did any other factors affect the weight loss of the patient? It should never be assumed that a nursing activity was the cause or the only factor in meeting, partially meeting, or not meeting a goal. Nurses use the judgments about goal achievement to determine whether the care plan was effective in resolving, reducing, or preventing patient problem. When goals have been met, the nurse can draw one of the following conclusions about the status of the patient's problem. The actual problem stated in the nursing diagnosis has been resolved, or the potential problem is being prevented and the risk factors no longer exist. In these instances, the nurse documents that the goals have been met and discontinues the care for the problem. The potential problem stated in the nursing diagnosis is being prevented, but the risk factors are still present. In this case, the nurse keeps the problem on the care plan. The actual problem still exists even though some goals are being met. For example, a desired outcome on a patient's care plan is will drink 3,000 milliliters of fluid daily. Even though the data may show this outcome has been achieved, other data like dry oral mucous membranes may indicate that the nursing diagnosis deficient fluid volume is applicable. Therefore, the nursing interventions must be continued even though this one goal was met. When goals have been partially met or when goals have not been met, two conclusions may be drawn. The care plan may need to be revised since the problem is only partially resolved. The revisions may need to occur during the assessing, diagnosing, or planning phases, as well as implementing. Or the care plan does not need revision because the patient merely needs more time to achieve the previous established goal. After drawing conclusion about the status of the patient's problem, the nurse modifies the care plan as indicated. Whether or not goals were met, decisions need to be made about continuing, modifying, or terminating nursing care for each problem. Remember, before making modification, the nurse must determine the effectiveness of the plan as a whole. This requires a review of the entire care plan and a critique of each step of the nursing process involved in its development. This slide shows you an example of evaluation statement. I hope it's helpful. Thank you for your attention. See you next time.